Queen Victoria, the widow on the table. It is 22nd of January 1901 and Osborne House on the Isle of Wight has fallen into silence. After 63 years on the throne, Queen Victoria, Empress of India, Grandmother of Europe, and the woman who reshaped the monarchy into a global brand, is dead. She is 81 years old, blind in one eye, rheumatic in her joints, and so swollen with age and obesity that her attendants can barely move her. For weeks, she has drifted in and out of a coma, murmuring names, slipping away in fragments until her heart finally fails. The official bulletin is neat and restrained. Her Majesty died peacefully, surrounded by her children and grandchildren. Cause of death? A cerebral hemorrhage, a stroke. But Victoria, ever the master of control, had forbidden any autopsy. She did not want to be dissected like her grandfather, George III. She wanted her secrets to remain buried. Yet here we are. We are going to do what her doctors didn't dare. We're going to cut her open, layer by layer, and read the story her body would have told if she had been given a modern post-mortem. This is Crowned and Autopsied, Queen Victoria, The Last Days. Victoria's decline had been painfully obvious. Once robust, she had grown progressively weaker after the 1890s. Her letters mention fatigue, swelling in her legs, clouded vision and forgetfulness. She frequently nodded off mid-conversation, sometimes seemed confused, and her appetite dwindled. On the 18th of January 1901, she suffered what we would now call a transient ischemic attack, a mini-stroke. 4 days later she had another, more severe. By the 22nd she was unconscious, breathing shallowly, and slipping away. Surrounded by Edward, Wilhelm, and her many children, she finally died in the evening. The external examination. Now she lies before us, a small elderly woman, just under 5 feet tall, but wide and heavy-set in her coffin. In her youth she was famously plump. In her old age she was obese. Her face is pale and waxy, jowls sagging. Her ankles are swollen with fluid, the telltale mark of heart failure. Her joints are stiff and knotted with rheumatism. Her skin shows the blotchy mottling of poor circulation. She looks every inch the matriarch of empire, but her body tells us the truth. Decades of vascular disease and metabolic decline. Opening the chest. The chest is opened. Immediately the heart commands attention. It is enlarged, its walls thickened from decades of battling high blood pressure. The coronary arteries are narrowed, clogged with fatty plaques. Victoria has severe coronary artery disease, the silent killer of the modern age. The lungs are heavy and congested, with fluid pooling in the lower lobes. This is the drowning effect of congestive heart failure. For years she had struggled with breathlessness. Now we see why. If she had lived in the age of blood thinners and statins, this might have been managed. In 1901, it was a death sentence. Into the abdomen. The knife travels down. The abdomen opens. Fat tumbles forward, thick yellow deposits smothering every organ. The liver is pale and greasy, classic fatty liver disease, the result of obesity and a sedentary life. The pancreas is scarred, showing signs of type 2 diabetes left undiagnosed and untreated. Her medical records mention excessive thirst and fatigue, symptoms her doctors wrote off as old age. The kidneys are small, shrunken, granular. They have been damaged by years of high blood pressure and diabetes. Victoria was heading towards chronic kidney disease, though no one dared suggest such a thing to the Queen. The intestines show irritation, likely from decades of heavy meat diets and minimal fibre. A lifetime of lavish royal dining has left its signature on her gut. The brain. Now the skull. Sawed open carefully, the brain is revealed, and here lies the final chapter. A large dark pool of blood sits in the left hemisphere. This is the cerebral hemorrhage that killed her, the stroke that silenced the Queen. The surrounding tissue is softened, compressed. Elsewhere, the brain shows scars of previous, smaller strokes, evidence that Victoria had been suffering minor cerebrovascular accidents for years. These would explain her increasing drowsiness, confusion, and lapses in speech. The arteries in the brain are stiff and narrow, severe cerebral atherosclerosis. Every vessel is a brittle pipe waiting to burst. This was not a sudden event. It was the culmination of years of damage. Modern diagnosis. If this were written up today, the cause of death would be clear. Primary cause, intracerebral hemorrhage, stroke. Contributing conditions, long-standing hypertension, coronary artery disease, obesity, type 2 diabetes mellitus, chronic kidney disease, rheumatism and immobility. In short, Victoria was a walking case study in what we now call metabolic syndrome, the deadly combination of obesity, diabetes, heart disease, and stroke. Lifestyle and risk factors. Her decline wasn't mysterious. Victoria's later life was sedentary. She spent long days writing letters, knitting, and sitting in heavy mourning. She hated exercise. Her diet remained rich: meats, gravies, puddings. She ballooned in weight. By the 1880s, attendants noted she was difficult to lift. This obesity fed her diabetes fed her vascular disease, and the vascular disease fed the stroke that killed her. The funeral secrets. But while the autopsy reveals disease, the funeral preparations reveal Victoria herself. She had scripted every detail. She would wear her wedding veil. She would be buried with Albert's dressing gown. And, in a final flourish, a lock of John Brown's hair and his photograph hidden beneath the lace. Even in death, she managed her own narrative. The doctors may have been forbidden to publish her diseased organs, but the woman herself ensured her burial carried its own scandal. The final irony. George III's doctors cut him open but ignored his brain. Victoria's doctors barely looked at all. In both cases, history was denied the full truth. But if we imagine her on the autopsy table, the picture is clear. Victoria did not simply die of a stroke. She died of decades of vascular disease, obesity, and diabetes, the same killers that haunt the modern world. The Empress of India, grandmother of Europe, ruler of half the globe, reduced at last to a brain drowning in blood and a heart smothered by fat. So that is Queen Victoria on the mortuary table. A heart enlarged by empire-sized stress, lungs drowning in their own fluid, kidneys scarred, liver greasy, brain burst by a final catastrophic stroke. The official verdict said, peaceful death. The autopsy tells us otherwise. A body battered by years of decline, a queen felled not by assassins or conspiracies, but by the same diseases that plague ordinary mortals. That was Past People, Queen Victoria. One queen, one forbidden autopsy. Maximum arteries clogged with empire-sized gravy. The modern autopsy of Queen Alexandra, the queen who smiled through the pain. Her pearls were perfect, her posture flawless, her smile eternal. But beneath the lace and laughter, Queen Alexandra was falling apart. For decades she limped, she hid, she suffered. And when death falling came, it was not from one disease, but from a body worn down by silence. Tonight we place Queen Alexandra of Denmark, consort to Edward VII, on the modern autopsy table, to uncover the truth behind the most beautiful queen in Europe. The fairy tale beginning. Once upon a time there was a princess who married a prince, and it actually looked like a fairy tale. Alexandra of Denmark, born 1844, was stunning, tall, elegant, glowing with the kind of beauty Victorian artists worshipped. When she married the Prince of Wales in 1863, London erupted. She was everything her husband wasn't. Pure, poised, adored. And Edward, or Bertie as everyone called him, wasted no time in making her life complicated. He was a serial adulterer. She was the perfect wife. The public saw grace. But behind palace doors she was living on nerves, duty and denial. The medical mystery of the royal bride. Our autopsy begins early. At 18, Alexandra contracted rheumatic fever, a bacterial infection that inflames the joints and damages the heart. It left her permanently with a limp and a weakened circulatory system. Doctors didn't know that rheumatic fever scars the heart valves. In modern medicine, we'd call this rheumatic heart disease, slow, progressive heart damage that can take decades to kill. By her 30s, Alexandra's ankles were swelling, her legs puffy with retained fluid, early signs of heart failure. But in public she smiled through the pain. In portraits, her slight tilt and tilted shoulders became her signature pose. In reality, they were compensation for chronic pain and hip misalignment. The queen who couldn't hear. Then came the silence. In her 20s, Alexandra began losing her hearing, the result of hereditary otosclerosis, a condition that calcifies the tiny bones in the ear. By middle age, she was almost completely deaf, but nobody knew. She hid it with lip reading, rehearsed conversations, and endless charm. She became a master of social camouflage, smiling, nodding, laughing at all the right moments. A modern autopsy would show calcified ossicles in both ears, particularly the stapes bone, the hallmark of advanced otosclerosis. In life she couldn't hear the world. In death her bones still carry the proof. The fashion victim. Let's talk about beauty and its price. Queen Alexandra was the original influencer. Her long neck, high collars and choker pearls started a worldwide trend. But behind the glamour, her fashion was hiding something. After a bout of severe rheumatic inflammation, one shoulder sat higher than the other, her famous tilted look. To correct it, she wore corsets so tight they displaced her ribs and restricted her lungs. Her waist measured under 20 inches. A modern autopsy would find chronic compression marks on the ribs, weakened intercostal muscles, and perhaps even displaced organs, the physical toll of Edwardian fashion. Her lungs would show scarring, not from smoking, but from years of shallow breathing in steel-boned corsets. The royal marriage and the stress within. Marriage to Edward VII was no fairy tale. While Alexandra raised 6 children, Edward raised his champagne glass with mistresses. Lily Langtry, Alice Keppel, the list went on. Alexandra endured them all, in silence. The public adored her martyrdom. The doctors missed its effects. Modern medicine knows chronic emotional stress raises cortisol levels, leading to hypertension, suppressed immunity, and, you guessed it, heart disease. So every scandal, every headline, every mistress didn't just break her heart figuratively, it literally damaged it. The final decline. When King Edward VII died in 1910, Alexandra didn't just lose a husband, she lost the one role that had defined her. She became the Dowager Queen, still beautiful, still regal, but increasingly frail. By her 70s, she was half blind from cataracts, fully deaf and suffering from heart failure. Her legs ballooned with edema, her breathing laboured, her appetite gone. She refused bed rest, refused medicine, refused to give in. The woman who had been the image of beauty could not bear to be seen as weak. In November 1925, the fluid in her lungs finally overwhelmed her heart. She died quietly at Sandringham, aged 81. The autopsy table. Let's examine her as a modern pathologist would. External examination. Elderly female, slender, visible joint deformities consistent with chronic rheumatic arthritis. Ankles and legs show edema, fluid swelling. Skin pale, slightly bluish, cyanosis from poor circulation. Internal findings. Heart, enlarged, valves thickened and scarred, classic signs of rheumatic heart disease. Lungs, congested with fluid, confirming pulmonary edema. Ears, ossified stapes bones, confirming total deafness from otosclerosis. Bones, deformed ribcage from decades of corsetry, mild scoliosis. Liver, congested from chronic heart failure. Cause of death? Congestive heart failure due to chronic rheumatic heart disease, worsened by decades of physical and emotional stress. The legacy of pain and poise. It's easy to remember Queen Alexandra as the serene Edwardian beauty, but the autopsy tells another story of endurance, silence, and suffering. Her deafness isolated her, her limp embarrassed her corsets crushed her, and her marriage humiliated her. But she never let the public see it. The doctors would say she died of heart failure, but the truth? She died of appearance, a lifetime spent being perfect at any cost. Closing reflections. If Queen Victoria's autopsy revealed exhaustion and Queen Mary's showed repression, Queen Alexandra's shows something quieter, the physical toll of silence. Her body was a battleground between expectation and endurance. Her heart gave out because it had nowhere left to hide. The official cause, heart disease. The real cause, a lifetime of grace under pressure. This was the modern autopsy of Queen Alexandra, the queen who smiled through the pain. Subscribe for more royal autopsies, scandals and secrets buried beneath the crown. The modern autopsy of Queen Mary of Teck, the woman who wouldn't die before her duty. London, March 1953. The grand halls of Marlborough House have fallen silent. The nurses move softly, careful not to wake the Queen, who will not wake again. Her name is Mary of Teck, and for 85 years she has kept her back straight, her chin up, and her emotions buried beneath diamonds. But tonight she's not a queen, or a mother, or the Iron Matriarch of the British Empire. She's a body on a bed, pale and still, and we're about to take her apart, piece by piece, to see what history tried to hide. The making of a steel monarch. Mary of Teck was never supposed to be queen. Born in 1867 to a German princess and a debt-ridden British duke, her childhood was more pawnshop than palace. Her parents pawned silver to pay rent. She learned early that money vanishes, but dignity? That could be faked with posture. At 24, she was engaged to Prince Albert Victor, Duke of Clarence and Avondale, the heir to the throne. But Albert Victor died suddenly of influenza before the wedding. It was a royal tragedy. Until a year later, she was quietly reassigned to his brother, George, the shy, serious, future George V. It sounds cold, but it worked. They grew fond of each other, perhaps even loved each other in their rigid British way, and together they ruled a world falling apart, from the Great War to the fall of empires, until death and disease began to pull them apart too. The body that wouldn't rest. By the time the 1930s rolled in, Queen Mary was a relic of a bygone world. Her sons mocked her stiffness, her daughters feared her, and the British public adored her, because she looked like stability. But behind the curtains, her body was already deteriorating. The autopsy begins with the heart. Her doctors reported mild gastric inflammation, but her medical records show a very different story. Years of gnawing stomach pain, relentless nausea, weight loss hidden beneath layers of satin and pearls. In modern terms, the Queen was dying of stomach cancer. If we opened her abdomen today, we'd find thickened stomach walls mottled with ulceration, a tumour likely near the pylorus choking her digestion. Every meal would have felt like swallowing stones, and yet she endured every royal duty. Every service, every photograph, every funeral, because Mary didn't do illness, she did duty. The disease of restraint. Stress leaves fingerprints on the body, and Queen Mary's life was nothing if not one long stress test. She buried her husband George V in 1936, just months before the monarchy exploded in scandal. Her eldest son, Edward VIII, abandoned the throne for Wallis Simpson, the woman Mary refused to acknowledge even as Mrs. Simpson. Her younger son, George VI, became king overnight, terrified, stammering, and she, once again, was the pillar propping up a monarchy cracking under its own weight. By the time George VI died in 1952, Mary was 84. Her joints had calcified with arthritis so severe she needed canes to move, but she attended his funeral anyway, wrapped in black silk, unmoving, her face a marble mask of control. Her body was quietly disintegrating, but she would not show it. Grief was a private luxury, one she'd never allowed herself. The final days. Fast forward to March 1953. London is grey, cold, tense with coronation fever. Her granddaughter Elizabeth II is about to be crowned, and Queen Mary is dying in bed a few miles away. Her doctors have noted gastric inflammation. Translation, stomach cancer, likely ulcerating into her intestines. She's frail, dehydrated, her heart struggling to pump blood through arteries hardened by age and grief. A modern autopsy would tell us the heart itself was enlarged, thick, muscular walls compensating for narrowed arteries, the price of years of anxiety and loss. Every heartbeat cost her effort, every breath was shallow. And yet, when courtiers brought her the final plans for the coronation, she insisted on reviewing them. Even then, her last recorded words, "All will be well." Within 24 hours, her heart gave out. The post-mortem. Let's lay her out. Elderly female, well-nourished but cachectic. Signs of chronic arthritis, fingers swollen, spine bent, knees fixed. Slight jaundice to the skin, consistent with liver strain. Internally, her stomach wall is rigid and inflamed, almost leather-like. At the lower curvature, a hard nodule, likely a malignant tumour, with surrounding tissue thickened and ulcerated. The liver shows congestion, the heart enlarged, with arteriosclerosis in all major arteries. A modern pathologist would sign her death certificate as cause of death, gastric carcinoma leading to heart failure. But her doctors, fearful of scandal and sentimentality, wrote it neatly as gastric inflammation and cardiac fatigue. It sounds almost polite, doesn't it? The medications that killed her. Like so many royals of her time, Queen Mary was treated to death. Aspirin for pain, which thinned her blood and worsened her ulcers. Codeine for the stomach, which slowed her bowels and deepened her fatigue. Digitalis for her heart, a poison in large doses. The combination would have left her anemic, dizzy, nauseous, and exhausted. And all the while, the real cause, stomach cancer, went untreated, unacknowledged, and perhaps willfully ignored. In a modern toxicology screen, we'd find evidence of salicylate poisoning and iron deficiency from years of slow internal bleeding. She was, quite literally, bleeding from the inside out, and nobody dared say a word. The legacy of endurance. Here's the irony. While her body failed, her reputation only grew stronger. After her death, the newspapers called her the last great queen. They said she embodied the monarchy's unshakable dignity. And maybe she did, but our autopsy tells a harsher truth. Queen Mary's body is a record of repression, ulcers from swallowed emotion, arthritis from decades of tension, a heart enlarged by duty. Every organ tells the same story, the cost of perfection. She raised kings, buried two, and survived long enough to see the crown passed again. She died knowing the monarchy would live on, because she had shaped it in her own cold, unbreakable image. Closing the case. When you peel back the silken jewels, Queen Mary's autopsy doesn't reveal scandal, it reveals sacrifice. A woman who lived through the death of empires and sons alike, who turned her own suffering into ceremony. Her bones are gone, her body dust, but her blueprint remains. Every royal woman since has borrowed something from her, the posture, the poise, the silence. The official line said she died of gastritis. The truth? She died of endurance. This has been the modern autopsy of Queen Mary of Teck. Subscribe for more royal autopsies because sometimes to understand history's crowns, you have to cut open the people who wore them. The modern autopsy of Marie Antoinette, the body beneath the crown. They called her the Austrian woman, the enemy in pearls, The queen who told the starving to eat cake, though she never said it. But if we place Marie Antoinette beneath the modern autopsy light, the fairy tale shatters, because behind the diamonds and decadence was a woman suffering from exhaustion, malnutrition, and the slow, methodical unravelling of both body and mind. This is not the autopsy of a villain, it's the autopsy of a survivor, one who finally stopped surviving. The body arrives at Versailles. She arrived in France a teenager, 14 years old, a Habsburg princess traded like diplomatic currency. Her body wasn't hers, it belonged to a treaty. Every part of her smile, her waistline, her womb, became political. Doctors measured her, courtiers inspected her, and when she failed to produce an heir immediately, the gossip began. By modern standards, she was underweight, anxious and malnourished, a textbook case of what we now call performance stress disorder. Her menstrual cycles were irregular, her digestion weak, and her nerves frayed. Yet she learned the golden rule of Versailles: never let them see you bleed. The stress of a crown. If we ran blood work from those early years, we'd find cortisol through the roof. Stress hormone levels that damage the heart, weaken immunity, and accelerate aging. Because Marie Antoinette wasn't living a royal dream, she was living a public experiment. Every movement was watched, every meal analysed. Every morning her body was dressed by 20 women, layer by layer, into a symbol. The crown came first, her health came last. The endless pregnancies. When she finally conceived, the pressure only grew. She gave birth to 4 children, but only 2 lived past infancy. Her body endured what 18th century doctors called royal confinement. Days in overheated rooms, heavy brocade gowns, and little hygiene. She lost teeth from calcium depletion, developed hemorrhoids from childbirth strain, and may have suffered uterine prolapse from repeated labours. Her 4th pregnancy left her weak, pale, and permanently changed. Her hair began to fall out. Her complexion dulled. In portraits, the queen who had once been painted as Venus now looked almost translucent, porcelain over bone. The migraine queen. Modern medical historians now suspect that Marie Antoinette suffered from chronic migraine disorder. Descriptions from her letters, splitting pain behind the eyes with nausea and flashes of light, match today's criteria exactly. In modern terms, she was neurologically overloaded. Poor sleep, poor diet, relentless anxiety and hormone fluctuation. The perfect storm for migraines that lasted days. Her fainting spells and vapours weren't hysterics, they were neurological collapses. If she'd had access to modern medicine, she'd have been prescribed rest, hydration and possibly beta blockers. Instead, she got cold compresses and humiliation. The diamond body. Let's talk about that fashion, the silk, the wigs, the powder, the poison. Marie Antoinette's beauty routine was a slow act of chemical self-destruction. Her white face powder contained lead carbonate, her rouge contained mercury sulfide, and her perfumes were laced with alcohol and animal fat. A modern toxicology test on her hair would show elevated lead and mercury levels, explaining her thinning hair, tooth decay, and possibly mood swings. The powdered perfection of Versailles wasn't glamour, it was poisoning. The revolution comes for the body. By 1789, the revolution was no longer just outside her palace, it was inside her bloodstream. The Queen's health deteriorated rapidly. She lost weight from constant stress and food shortages at court. Witnesses said her cheeks were hollow, her skin waxen, her nails brittle. Chronic diarrhea and fainting fits were recorded, all consistent with starvation and vitamin deficiency. In 1791, she fled Versailles for the ill-fated escape to Varennes. The journey nearly killed her. She rode for days without sleep, under constant fear of death. Modern medicine would call it acute stress disorder, compounded by dehydration and exhaustion. Her adrenal system completely shot. The prison autopsy. Fast forward to the Temple Prison, 1792. The Queen is 40 years old but looks 60. She's lost half her body weight, her gums are receding, her menstrual cycle has stopped, an early menopause triggered by malnutrition and trauma. She spends months in damp cells, sleeping on straw infested with lice. Her clothes rot, her hair turns white, literally, within weeks. A condition called Marie Antoinette syndrome, or acute stress-induced hair depigmentation. When her friend Madame Campan saw her before the trial, she fainted. The Queen's once sculpted face was gaunt, her skin sallow, her eyes sunken, but still defiant. The final morning, October 16th, 1793. Marie Antoinette wakes at dawn in the conciergerie. Her guards strip her of mourning black and dress her in plain white. She is led to the guillotine, her hands tied so tightly that her fingers swell. If we were to perform a physiological scan at that moment, her heart rate would be around 140 beats per minute, adrenaline surging, her body in fight or flight mode, the final flood of cortisol before cardiac collapse. Her pulse would have been pounding in her ears, except she was calm. Eyewitnesses said she apologized to her executioner after stepping on his foot. Her last words were not dramatic, they were polite. "Pardon me, sir, I did not do it on purpose." The modern autopsy. Let's lay her on the modern table. External examination. Female, aged 37, 5 feet 1 inch, severely underweight, pale, brittle hair, missing posterior molars, nail discoloration from malnutrition. Internal findings. Heart, mild hypertrophy from chronic stress. Stomach, signs of gastritis from years of anxiety and poor diet. Liver, fatty degeneration, malnutrition and prolonged fasting. Bones, demineralization consistent with calcium deficiency and prolonged confinement. Skin and scalp, early depigmentation, stress-related. Toxicology, traces of lead and mercury from cosmetics. Cause of death, modern, decapitation, but underlying conditions show extreme malnutrition, endocrine dysfunction, chronic stress and heavy metal toxicity. In simpler terms, she was already dying before the blade ever fell. The anatomy of defiance. History calls her vain, science calls her a miracle of endurance. The autopsy reveals a body starved, poisoned and broken, yet still upright to the very end. Her heart bore the stress of exile, her nerves bore the fear of death, her bones bore the burden of centuries of blame. The revolution took her head, but her body tells the story of how the monarchy was already bleeding long before the guillotine. Closing reflections. The official cause of death, execution. The modern verdict, exhaustion, physical, emotional and human. Marie Antoinette didn't die of revolution. She died of a lifetime of expectation. This was the modern autopsy of Marie Antoinette, the body beneath the legend. Subscribe for more royal autopsies, because sometimes the crown weighs more than the head that wears it. Elizabeth I, the Virgin Queen on the table. It is the 24th of March, 1603, and the great Tudor age is ending in a whisper. Queen Elizabeth I, the Virgin Queen, Gloriana, the woman who defied Spain, executed Mary Queen of Scots, and ruled England for 45 years, is dying at Richmond Palace. The final weeks have been bleak. Elizabeth sits slumped on cushions, refusing to lie in bed, staring into the shadows with hollow eyes. She mutters to her ladies that she sees spirits, that the walls whisper to her. She will not eat, she will not rest, she simply wastes away, a living ghost in ruffs and velvet. When she finally slips away in the small hours, the cause of death is politely described as old age. But that bland phrase hides the real questions. What killed her? Why did her body fail the way it did? And what would we find if we placed Elizabeth I on a modern mortuary slab? Let's find out. The last days. Elizabeth was 69, an impressive age for the early 17th century, but not impossibly old. Yet her decline was dramatic. She had lost weight rapidly, refused food, and fell into deep melancholy after the deaths of her close friends, especially the Countess of Nottingham. Her skin was pallid, her body frail beneath the layers of paint and jewels. She had open sores and ulcers on her legs, complained of toothache, and was prone to fainting fits. Her courtiers noted that she looked consumed, a word they often used for cancer. By March, she was sitting motionless for hours, barely speaking. When she did, her words were sometimes confused. This was not just grief. Something was breaking down inside her. The external examination. On the table, Elizabeth's body would be startling. The famous queen, once a flame-haired icon, is now skeletal and wasted. Her skin is pale, blotchy, with ulcerations on the lower legs, the legacy of poor circulation and possibly diabetes. The teeth are blackened and cracked, rotted from years of sugar, wine, and tooth powders laced with mercury. Her wig is removed, revealing thinning grey hair. Her fingers are stained, the nails brittle. She looks every inch the frail old woman she refused to let anyone see alive. Opening the chest. The chest is opened, the ribs spread. Inside, the heart is shrunken, its vessels narrow and stiff with fatty deposits. Elizabeth has advanced coronary artery disease. Her heart has been straining against high blood pressure for years. The lungs are scarred with patches of old infection, chronic bronchitis perhaps from a lifetime of smoky halls, coal fires, and the heavy perfume she adored. Fluid pools at the base of the lungs. In her final days she had struggled for breath, the beginnings of heart failure. Into the abdomen. The abdomen tells an even more interesting story. The intestines are pale, lined with ulcers and scarring. Elizabeth's diet had been heavy on sugar, meats and wine, and her digestive system shows it. The liver is enlarged and yellow, with nodules across the surface, a sign of cirrhosis, probably not from alcohol alone, but from years of poor diet and chemical-laced cosmetics. The pancreas is atrophied and scarred, consistent with type 2 diabetes, undiagnosed but likely present. This would explain her wounds healing poorly, her fatigue, her weight loss and her constant thirst. The kidneys are small and granular, showing chronic disease. High blood pressure and diabetes had been chewing away at them for years. The brain. When the skull is opened, the brain confirms the suspicion. The vessels are narrowed, brittle, several showing the scars of tiny old strokes. These would explain her confusion, her fainting fits, her slurred speech. Most dramatic of all is a large hemorrhage in the cerebral cortex, a stroke. This was the blow that silenced Elizabeth, the final collapse of a vascular system that had been crumbling for years. Modern diagnosis. So what would the coroner write today? Cause of death? Stroke due to long-standing vascular disease. Contributing conditions? Coronary artery disease, hypertension, type 2 diabetes mellitus, chronic kidney disease, cirrhosis of the liver, chronic infection and malnutrition. In short, Elizabeth was not killed by one thing, but by a web of interconnected diseases, the metabolic syndrome of a Tudor queen. The cosmetics connection. There is another suspect in her decline, lead poisoning. Elizabeth was famous for her white mask of makeup, Venetian ceruse, a mix of white lead and vinegar. She wore it daily for decades. Her skin beneath was raw and ulcerated. Her hair fell out, her teeth blackened. A toxicology screen on her bones would almost certainly reveal high levels of lead, mercury, and arsenic, poisons she layered on herself in the name of beauty. These metals damaged the kidneys, the brain, the nerves. They may have accelerated her dementia, her depression, her tremors. The Virgin Queen was quite literally poisoned by her own vanity. Lifestyle and risk factors. Elizabeth was not a glutton like Henry VIII, nor a smoker like Edward VII, but she was not healthy either. She ate sugar in dangerous quantities, painted herself with toxins, refused medical intervention, and drove her body with stress, grief, and ceaseless vigilance. In her 60s, she lost weight rapidly, likely from diabetes or cancer. She withdrew, grew paranoid, and finally collapsed into the depression that consumed her final weeks. The final irony. Elizabeth's courtiers said she died of melancholy, a broken spirit. The doctors said old age. But an autopsy would show something far less romantic. Blocked arteries, a burst vessel in her brain, organs poisoned by sugar and lead. She wasn't taken by fate, she wasn't consumed by love or grief. She was killed by the same things that kill millions today: stroke, diabetes, heart disease, poisoning from the chemicals she trusted. Gloriana, the woman who ruled with iron will, undone by her own body. So there lies Elizabeth I, imagined on the mortuary table. The Virgin Queen stripped of her wigs and her paint, her body telling the story she tried so hard to hide. A brain drowned in blood, a liver scarred by poison, kidneys shriveled, teeth black, and a heart that simply couldn't beat any longer. That was past, people. Elizabeth I, one queen, one body betrayed. Maximum lead, maximum legend. The modern autopsy of Queen Charlotte, the hidden ailments of a Georgian queen. Forget Bridgerton's powdered perfection. The real Queen Charlotte wasn't just all wigs and waltzes. She was a woman whose health collapsed under the weight of royal duty, 17 pregnancies, and the chaos of a crumbling monarchy. So, what would a modern autopsy of Queen Charlotte reveal? Setting the scene, the queen who outlived her own era. Charlotte of Mecklenburg-Strelitz, born in 1744, married at 17 to George III, and spent nearly 6 decades trapped in a gilded cage of duty, disease, and domestic disaster. She was the longest-serving British Queen Consort at the time, the grandmother of Queen Victoria, and the woman who watched her husband, the King of Great Britain, slowly lose his mind. But long before her own death in 1818, Charlotte's body was keeping its own royal secrets. If we placed her on a 21st century autopsy table, what would her body tell us about the toll of empire, childbirth, and grief? The case file. Name: Charlotte of Mecklenburg-Strelitz. Age at death: 74. Occupation: Queen Consort of the United Kingdom, mother of 15. Well, technically 17 pregnancies, 15 live births. Date of death: 17th November 1818. Location: Kew Palace, Surrey. Primary reported cause: dropsy, what we'd now call congestive heart failure with fluid retention. The symptoms. By the last decade of her life, Queen Charlotte was visibly unwell. Her ladies-in-waiting wrote that her legs were swollen to the size of barrels. Her breathing was laboured, her energy non-existent. She also suffered from arthritis so severe she could barely stand. Doctors of the day diagnosed dropsy, a vague Georgian term meaning fluid where it shouldn't be. To us, that screams chronic heart failure, likely triggered by hypertension or kidney disease. Modern autopsy begins. If this were a modern coroner's case, we'd start with the heart. It would almost certainly show hypertrophy, thickened muscular walls from decades of strain. Her arteries, probably laced with atherosclerosis, calcium buildup that narrowed her blood vessels, restricting oxygen and overworking her heart. Fluid would be found in the lungs and abdominal cavity, the telltale signs of end-stage heart failure. In other words, her heart simply couldn't keep up anymore. Complicating factors: the Queen who bred an empire. Now, let's talk about those 17 pregnancies. Each one was a risk. Childbirth in the 18th century was brutal. No sterilisation, no antibiotics, no pain relief, and no concept of postpartum care. Repeated pregnancies would have caused pelvic prolapse, organs sagging from weakened support muscles, iron deficiency anemia, and chronic postpartum infections, probably leaving long-term inflammation in her body. In modern terms, her heart didn't just fail, it was exhausted. Psychological stress and grief. Her husband's mental collapse was catastrophic. For more than 2 decades, Queen Charlotte acted as both monarch and caretaker. She endured violent episodes, isolation, and public scrutiny. Modern medicine tells us chronic stress releases cortisol, which raises blood pressure, damages the heart, and weakens immunity. So yes, even her grief was killing her. Imagine living each day wondering whether your husband might attack you, and being expected to smile at the orchestra that night. The treatments that made it worse. 18th century medicine was a circus. When Queen Charlotte's dropsy flared, doctors reached for the usual horrors. Bleeding, to release bad humours. Blistering, using hot plasters to draw out fluid. And everyone's favourite, calomel, a mercury-based purgative guaranteed to poison you slowly. In other words, the cure was as deadly as the disease. A modern toxicology screen would almost certainly find mercury residue in her liver, kidneys and hair. Chronic mercury exposure from years of treatment. What we'd find in the modern morgue: external examination, a frail woman, mid-70s, advanced edema, swelling, arthritic deformities in hands and knees, skin mottled, likely from poor circulation and heart failure. Internal examination: heart enlarged, thickened, left ventricular hypertrophy. Lungs congested, fluid-filled, signs of chronic pulmonary edema. Kidneys pale and granular, hypertensive or nephrotic damage. Liver fatty changes, possible cirrhosis from decades of poor circulation and medication toxicity. Toxicology: high mercury and opium traces, both common prescriptions of the era. Cause of death: modern verdict. Primary cause: congestive heart failure due to chronic hypertension and cardiac hypertrophy. Secondary factors: long-term mercury exposure, chronic infection, anemia, postpartum damage and psychological stress. Manner of death: natural causes, accelerated by 18th century medicine. Legacy and reflection. Queen Charlotte's body failed her, but not before she produced the next century's ruling dynasty. Her son became George IV, her granddaughter became Queen Victoria, and her bloodline still sits on the throne today. Yet in her final years she was no glittering monarch, just an elderly woman gasping for breath in a damp room at Kew, her children fighting over her will, and her husband still locked away in madness. The autopsy might give us science, but the tragedy gives us humanity. In the end, Queen Charlotte's greatest legacy wasn't her crown, it was her endurance. And now, centuries later, the evidence of her suffering is written not in history books, but in her body itself. Subscribe for more royal autopsies, scandals and secrets. Mary I, the phantom pregnancies on the table. It is 17 November 1558, and London is about to erupt in both mourning and relief. Mary Tudor, Bloody Mary to Protestants, the first crowned queen regnant of England, is dead at 42. For 5 years she ruled with fire and faith, burning heretics at Smithfield, marrying Philip of Spain, and fighting to restore Catholic England. But her reign ended in sickness, despair, and childless failure. The official story? She died of influenza during a nationwide epidemic. But her body told a different tale, one that courtiers dared not whisper. Mary had suffered 2 mysterious pregnancies that produced no child. By the end she was swollen, fevered and in agony. No autopsy was performed, but what if there had been? Today we're laying Mary I on the slab to uncover what really killed the Queen who could not carry an heir. The last days. Mary had been unwell for months before her death. She grew thin and pale, though her belly swelled at times. She complained of constant abdominal pain, irregular bleeding and weakness. By autumn 1558 she was bedridden, feverish and plagued with a persistent cough. Some chroniclers said she was consumed, others noted she wasted away with her stomach hard and distended. Her ladies whispered it was cancer, her priests called it God's punishment. On the 17th of November, as bells tolled across London, Mary breathed her last. The external examination. On the mortuary table, Mary's body is frail, shrunken, the frame of a woman aged beyond her years. Her face is hollow, her skin waxy, mottled with fever rash. Her belly, though, is swollen and taut. Not the curve of pregnancy, but the distension of fluid. Ascites, the build-up of liquid in the abdomen, a sign of advanced disease. Her legs are thin, wasted, but her feet are swollen. She looks like a woman whose organs have failed her from within. Opening the chest. The rib cage is cut open, the lungs are congested, heavy, inflamed. She did indeed have bronchitis and pneumonia, which could have hastened her death, but that is not the root cause. The infection was secondary. The heart is small, relatively normal for her age, though its arteries show the beginnings of narrowing. This is not a cardiac death. Into the abdomen. Now the truth. The peritoneal cavity gushes with fluid, litres of pale liquid filling her belly. The intestines are compressed and pale, pushed aside by growths. The liver is nodular, scarred, with surface tumours. The stomach and uterus are distorted, with lesions peppering the tissue. This is cancer, almost certainly of the womb, uterine cancer, or ovaries, spreading to the abdomen. The pregnancies Mary endured were not pregnancies at all, but phantom pregnancies caused by tumours. Her belly swelled, her breasts tender, her period stopped, all mimicking pregnancy, while cancer advanced unseen. By 1558 the disease had metastasized, the swelling, the bleeding, the pain, the fever, all the marks of terminal gynecological cancer. The brain. The skull is opened, the brain is pale but largely intact, no sign of stroke. Her madness was never in the mind but in the agony of her body. Modern diagnosis. If written up today, primary cause of death, metastatic uterine or ovarian cancer. Contributing factors, ascites, fluid buildup from cancer spread, secondary pneumonia from weakness and immobility, chronic anemia from bleeding. Mary's death certificate would not say influenza, it would say cancer. The theories. Influenza epidemic? Yes, England was suffering a flu outbreak in 1558 and Mary caught a respiratory infection. But this was not what killed her. She was already dying. Pregnancy? Number. Twice she believed she carried a child. Twice her belly swelled. Twice she endured the humiliation of no baby. What she had was cancer, mimicking pregnancy symptoms. Divine punishment? Her Protestant enemies loved this explanation. The queen who burned heretics was herself consumed by fire from within. But the truth was far less poetic and far crueler. The final irony. Mary believed her whole purpose was to bear a Catholic heir. Instead, the very organ meant to give her a child betrayed her. Her womb did not produce life, but death. She died, convinced she had failed, her throne slipping to her Protestant half-sister Elizabeth, her body rotting with tumours. The Virgin Queen may have ruled after her, but Mary was the queen whose body was haunted by phantom children, her legacy written in blood and pain. So there lies Mary the First on the mortuary slab, a shrunken queen, belly distended not by life but by cancer, her lungs drowned by infection, her womb consumed by tumours, her reign ended by the very disease that mocked her greatest hope. That was past, people. Mary the First. One queen, 2 phantom pregnancies, maximum Tudor tragedy.